Good morning. It is still Sunday the 29th of March and I'm about to cover symptoms of the COVID-19 disease. So what symptoms are you likely to get? You've probably read most of this in the press already, but just to go through that and what you need to do and what you can do to keep yourself healthy if you have any of the mild symptoms. So common ones we know about are fever, continuous cough, headache, stomach cramps, running to the bathroom a lot more, you may have some diarrhea, then chest tightness, we would consider that verging on a severe or moderately severe symptom, but shortness of breath being a severe symptom. So if you feel short of breath, you can't talk in sentences to your family or somebody on the phone, or if you're short of breath going up the stairs when you're not normally short of breath, or cooking, then speak to your doctor straight away. Okay, make sure and tell them straight away, I'm short of breath, and you will most likely need seen, and that can be organised for you. So if you're very short of breath and if you have any severe chest pain, then you do need to call an ambulance and explain to them exactly what's going on so that they're prepared as well. So other mild symptoms, so we'll keep with the mild ones at the minute. If you're well, you're able to drink, pass plenty of urine, maybe eat a little bit, and you just have a cough and a fever, you can stay at home. You may just have a headache, you may have a loss of taste, loss of smell, aches and pains, just general flu-like symptoms. You may have a few sniffles. So fluids are really important at this time, and also taking a little bit of paracetamol to reduce your fever and reduce the symptoms that you have so that you feel okay and you can eat and keep yourself well hydrated. If you are somebody that is on blood pressure medications, then speak to your GP straight away, and they are most likely going to tell you, if you're on an ACE inhibitor or a water tablet, they're going to tell you to hold those for a few days, okay, and you can monitor your blood pressure at home, make sure that's okay. And the reason you want to hold those is because they all work via your kidneys, and when you have a flu, you're more likely to become dehydrated, and so you don't want something that is stopping your kidneys working really well. You don't want to be taking that at the same time as having the flu, because you can become more sick very quickly. So speak to your GP straight away. If you are a diabetic, for example, so it depends on whether or not you're on insulin or a tablet to lower your blood sugar. So your tablet you may have to hold your tablet. It just depends on your situation. So always speak to your doctor straight away before doing any of those things. But if you're on an ACE inhibitor or a similar ARB2 or a water tablet, or perhaps a tablet for diabetes, then speak to your GP, because you're probably going to have to hold those for a few days until you're feeling better. Okay. There's been some talk about not taking non-steroidal anti-inflammatories, and that's another term for ibuprofen. So it's a class of drugs. Ibuprofen, diclofenac fall into that class. Naproxen, you might be on it for back pain. You might be on it if you have rheumatoid arthritis or osteoarthritis, or any other kind of pain as such, or perhaps for migraines. So it's probably best to avoid those if you can. If you need them for severe pain, then of course keep going. But if you become sick, stop those as well, because they affect how your kidneys work, and you don't want to get into difficulty with your kidneys at the same time. Okay, so paracetamol, fluids, speak to your GP if you have severe symptoms, or if you are on any of those tablets for high blood pressure or for diabetes. Also, if you are immunosuppressed, so you'll know this term if you are. So if you're on, for example, steroids every day, or another type of medication, and it could be for a number of things. It could be for kidney disease, it could be for disease of the intestines, if you have ulcerative colitis, if you have psoriasis, or if you have rheumatoid arthritis or another inflammatory arthritis, speak to your doctor. Your doctor will guide you, your rheumatologist, your gastroenterologist, they will guide you, or your GP will guide you via them. So they're the main things. If you have symptoms, don't panic. If they're severe, speak to somebody early, and plenty of fluids. If you live in a hot country, I don't know if anybody's listening from there, then obviously you're going to need more fluids. If you have air conditioning on, it's going to dry out the body a little bit more. You'll know yourself you'll need more fluids than the typical 2 to 3 litres. And as I said, if you have heart failure, then you know you have to monitor just how much fluid you take in. You don't want to be overloading with fluid. Okay, I hope you find that useful. If you have any questions or any comments, please leave them below. And if you get a chance, please like the video. That would be great. And that's all for now. I hope everyone stays healthy and that we can really tackle this with social distancing and then eventually a vaccine down the line. So yes, thanks for listening. Bye.